Constipation affects almost everyone at one time or another. In Module 4, you learn that eating enough dietary fiber, sitting in the best position on the toilet, drinking enough water, daily activity like walking, not postponing the urge to have a bowel movement, and certain laxatives are all helpful and appropriate strategies for relieving constipation. Please be familiar with this information prior to watching Get It Moving. The objectives for this module are to provide detailed information about fiber and how to include more in your diet as a treatment for constipation, to understand the benefits and risks of fiber supplements and how they affect bowel movements, to discuss medication that may be a cause of constipation and those medications that are used to treat constipation, and to introduce you to other treatment options being researched. Everything slows as we get older, including our bowels, and there are many causes of chronic constipation. You can become constipated if you have a problem that affects your large bowel, also called your colon, in one or more of three ways. Your intake. This is the food, water, and fiber that you eat and drink. One symptom of this is that you usually pass small amounts of hard stool. Transit, which is how quickly waste moves through your colon. Your bowel movements might be infrequent and you might not feel the urge to go, or you get more and more bloated between bowel movements. And outlet, meaning how stool leaves your body. For example, you have the urge to go, but you strain and your bowels don't move. As mentioned, you can become constipated if you have a problem that affects your colon in one or more of these three ways. As a reminder, see your doctor or nurse practitioner for any bleeding from the rectum, losing 10 pounds or more in 6 months, or constant constipation that doesn't respond to treatment. Perhaps you're wondering, is constipation harmful? Sometimes constipation can lead to complications. These complications include hemorrhoids or prolapse caused by straining to have a bowel movement, and anal fissures, which are tears in the skin around the anus caused by hard stool stretching the sphincter muscle. Sometimes constipation may cause hard stool to pack the intestine so tightly that the normal pushing action of the colon is no longer enough to expel the stool. This is called fecal impaction. It can happen to anyone, but occurs most often in children and older adults. Ongoing constipation can cause abdominal pain and bloating, and it can also affect the bladder and how it functions. The best strategy for avoiding complications is to prevent constipation from occurring in the first place, and if it does occur, be proactive to treat it. Eating a well-balanced, high-fiber diet can be a good first step. Fiber is the part of plant foods that we cannot fully digest. It is also called roughage or bulk. Fiber is an important part of our diet and has many health benefits. A high-fiber diet gives a feeling of fullness, which may help with weight control, and fiber may help prevent diabetes and colon cancer. Fiber makes our stool bulkier and moves waste through our intestine faster, so we have more regular bowel movements. Fiber is soluble if it dissolves in water, or insoluble if it doesn't. Many high-fiber foods contain both types of fiber. Soluble fiber dissolves in water into a gel-like material. It absorbs water and also slows the absorption of sugar, fat, and cholesterol in the intestines. This helps to control blood sugar levels, lower high blood pressure, and decrease LDL, which is the bad cholesterol. Because soluble fiber absorbs water, it helps manage symptoms of diarrhea or loose stools by making them firmer, and it may help people with irritable bowel syndrome. Soluble fiber also helps the good bacteria in the intestine to grow, which lowers the risk of ulcers. Foods high in soluble fiber include oatmeal, oat bran, barley, carrots, potato, peas, beans and lentils, some fruits, especially apples, pears, apricots, strawberries, bananas, and oranges, and psyllium. Psyllium may be added to cereals, for example, all bran buds, to increase the fiber content. Insoluble fiber comes from the cell wall of plants and does not dissolve in water. It adds bulk or roughage. This helps the movement of waste through the digestive system by increasing the amount of stool and by sweeping out the large bowel. Insoluble fiber lowers the risk of developing hemorrhoids and diverticular disease, which is a disease where small pouches form in the colon. Also, a diet high in this type of fiber is associated with a lower risk of cancer in the colon. Insoluble fiber is found in the skins of vegetables and fruits and the bran portion of whole grains. Good sources of this type of fiber include products made with whole wheat flour and other whole grains, high fiber cereal, vegetables, wheat bran, lentils, beans, nuts, and fruits, especially those with edible seeds and skins. You might think of soluble fiber as an absorber and insoluble fiber as a sweeper. Most high fiber foods contain both types of fiber. Remember, the overall function of fiber is to improve digestion and detoxify the body, and this has an additional benefit of helping to achieve a healthy weight. Inulin is another type of fiber which may be added to some cereals, granola bars, yogurt, and fiber supplements. It may help prevent constipation and may help healthy bacteria to grow in the large intestine. More research is needed to understand the health benefit of this type of fiber. Sometimes more or less fiber is recommended depending on your overall health and the symptoms that you are experiencing. We recommend that women aim for 25 to 35 grams of fiber each day to get the greatest health benefits. Most Canadians eat only half the fiber they need for optimal health. This means that most people should try to increase their fiber by 10 to 20 grams every day. Packaged foods will be labeled with information about the fiber content in the food. When you shop, learn to read the food labels to compare products and to help you choose higher fiber foods. Foods which claim to be a very high source of fiber must contain at least 6 grams of fiber per serving. Foods claiming to be a high source of fiber must contain at least 4 grams of fiber per serving. And foods which claim to be a source of fiber must contain at least 2 grams of fiber per serving. You can see some examples on this slide. To help you figure out if you're getting enough fiber, you might want to download Your Fiber Score from the main menu. It contains the fiber content of many common foods and can help to guide your fiber choices. As an example, you would need to eat 4 to 5 servings of very high source fiber every day. Adding fiber to your diet can have some unwelcome side effects initially, such as abdominal bloating or gas. It is important to increase your dietary fiber slowly. Start by adding 1 or 2 high fiber foods per day for a few days, and also be sure to increase your fluid intake. Your body will gradually adapt to more fiber. People who have narrowings in their digestive tract, called strictures, should be very cautious about large increases of fiber in their diet. And if you have had any previous bowel surgery or blockages or obstructions, please discuss this with your medical caregiver before increasing your dietary fiber. Following are some tips for eating more fiber. Choose high fiber and whole grain foods whenever possible. For example, switching from white rice to brown or wild, regular pasta to whole wheat pasta, or white bread to 100% whole wheat bread. Eat fresh fruit instead of drinking juice, and eat the skins or peels whenever possible. Pears and apples are excellent choices. Start your day with a high fiber cereal, one with 4 grams or more of fiber per serving. Then add some fruit such as berries or dried fruit. Try a cereal containing psyllium for as much as 12 grams of fiber per serving. You might also try sprinkling 1 to 2 tablespoons of high fiber cereal, ground flax, or bran on yogurt or applesauce. Salads are an easy way to add fiber, but you can also add cooked vegetables, beans, peas, or legumes to casseroles, soups, spaghetti sauce, and stews to up your fiber intake. Add bran or wheat germ to hamburger patties, casseroles, soups, cereal, and baking. Or try replacing some of the flour in baking with whole grain wheat, oat, or barley flour. Try your best to get the fiber you need in your diet. Remember, it may take several weeks to help your body to adjust to a new pattern of soft, regular bowel movements. Once things are improving, it's important to keep doing what is working well so that you don't return to constipation. As mentioned previously, a high-fiber diet can help with weight control. High-fiber foods usually require more chewing time, which gives your body time to register when you're full, so you're less likely to overeat. Also, high-fiber foods tend to make a meal feel larger, and because they take more time to digest, you stay full for a greater amount of time. And high-fiber foods tend to be less energy dense, which means that they have fewer calories for the amount of food eaten. In fact, fiber itself does not contain any calories since it does not get absorbed. You are probably already aware that prunes are a natural laxative. Try eating 2 to 3 prunes or drinking half a cup of prune juice on occasion if you find yourself becoming constipated. Figs, kiwi fruit, licorice, and molasses are also natural laxatives. Some people who are constipated find that they need additional help from fiber supplements. Keep in mind that a supplement does not replace a healthy, high-fiber diet. Common fiber supplements include psyllium husk, weak dextrin, or inulin. Metamucil, Benefiber, and FiberSure are examples of these types of supplements. Of these, only psyllium husk has strong research to show its effectiveness in treating constipation. Psyllium husk and wheat dextrin work by absorbing water in the colon to form a gel, increasing the size and weight of our stool and softening it. Because the stool is larger and heavier, the bowel is stimulated to move, usually within 12 to 72 hours. 1 dose of psyllium provides only 3 grams of fiber, but works well because of its special water-holding ability. Start with 1/2 or 1/4 of the regular dose and increase slowly to prevent cramping or gas. Fiber supplements are safe to use every day for years since there are few side effects. However, because psyllium may affect the absorption of any medications taken by mouth, plan to take your oral medication either 2 hours before psyllium or 4 hours after. Speak to your pharmacist if you have any questions. Methylcellulose is a chemical compound that is commonly used as a thickener and emulsifier in various food and cosmetic products, and also as a treatment of constipation. When eaten, it cannot be broken down or absorbed by our intestines. It is a white powder that will only dissolve in cold water, not in hot water, and it forms a clear solution or gel. It attracts large amounts of water into the bowel, producing softer, bulkier stools. When it's used as a treatment for constipation, it is very important to drink sufficient fluids to prevent dehydration. A well-known trade name of methylcellulose is Citrusel, but many generic versions are also widely available. Some people, including those with irritable bowel syndrome or celiac disease, cannot tolerate certain forms of dietary fiber or fiber supplements. Remember, if you have particular dietary concerns, a registered dietitian is available to assist you. Next, we'll explore the different types of laxatives, how they work, recommendations for use, and common side effects. Laxatives differ in the way they trigger a bowel movement to occur. Research has found osmotic laxatives, especially polyethylene glycol and lactulose, to be better than other types of laxatives for relieving chronic constipation. These laxatives stimulate the wall of the intestine to keep water in the colon, softening the stool and increasing the frequency of bowel movements. These laxatives can be used safely every day for years. Polyethylene glycol, also known as PEG laxatives, work within 1 to 4 days. The dose can be adjusted upward or downward to get the desired effect. Only 1 dose per day is required. Common examples are Restorelax, Relaxa, Miralax, and Laxaday. These laxatives are sugarless and tasteless. Many marketers claim that these laxatives do not cause abdominal cramping, bloating, gas, or urgency of bowel movements, although these symptoms will occur if the dose is too high. Lactulose, also an osmotic laxative, is a type of man-made sugar that is not broken down by the enzymes in our intestine. As a result, water and salts remain in the intestine, softening the stool and increasing the frequency of bowel movements. You do not need a prescription for lactulose, but it is kept behind the counter, so you will need to speak to the pharmacist to get this product. Lactulose typically works within 24 to 48 hours. Bloating, gas, abdominal cramping, and diarrhea are common side effects. A third type of osmotic laxatives are saline laxatives. Milk of magnesia or magnesium citrate are examples of these. They work more quickly than the other osmotic laxatives, with bowel movements usually happening within 1/2 to 3 hours. The common side effects of bloating, gas, abdominal cramping, and diarrhea occur more frequently than with the other osmotic laxatives. Also, high magnesium levels, especially for people with kidney disease, is a potentially serious side effect of these laxatives. Next, we'll look at other types of medications that are used for relieving constipation, which are recommended for short-term use only. These include stimulant laxatives, suppositories, and enemas. Regular use of these products can have serious side effects for some people. Consider discussing the use of these products with your pharmacist. This group of laxatives works by irritating the intestinal lining, causing the bowel muscle to move stool along quickly, and also to keep more water in the stool. Common stimulant laxatives contain senna. Senokot is an example. Bisacodyl, Correctol, and Dulcolax are examples. Cascara or aloe. Cascara and aloe are often found in herbal type laxatives. While most are taken by mouth, some can be inserted into the rectum. It generally takes 6 to 12 hours for these laxatives to be effective. Intestinal cramping, bloating, gas, and diarrhea are common side effects. If you use these laxatives on a regular basis, the bowel muscle can weaken and become lazy, and the dose must be continuously increased for the laxative to work. Also, serious imbalances of the salts in your blood can occur. Allergic reactions are also known to happen. If you are taking these types of laxatives on a regular basis, we recommend that you gradually switch to one of the more effective osmotic laxatives. Your pharmacist, physician, or clinic RN can assist you to make this transition. Suppositories and enemas are put into the rectum to empty it when the stool is too hard or blocked. For most people, they should be used only occasionally. Suppositories trigger bowel movements by irritating the rectum. Enemas expand and irritate the rectum, which makes the colon contract to push the stool out. Some types of enemas also soften the stool. Suppositories and enemas typically cause short-term cramping and usually work within 15 to 30 minutes. To recap, so far we've discussed dietary fiber, fiber supplements, and commonly used laxatives which are used to stimulate bowel movements. Stool softeners are detergents which contain an ingredient that makes water mix into the stool to soften it. Examples are docusate sodium or docusate calcium, commonly called colace. Stool softeners have few side effects, but there is little scientific evidence to recommend using them for chronic constipation. It may take up to 7 days for them to be effective. Gas and mild intestinal cramping are the common side effects. Next, we'll be exploring some less well-known treatments for chronic constipation. Probiotics are live microorganisms that work to keep our colon healthy by balancing our good bacteria and bad bacteria, keeping the stool soft and easy to move. The most common species are Lactobacillus and Bifidobacterium. Research on probiotic use is still early, but very promising. Food sources of probiotics include live culture yogurt and yogurt drinks, honey, bananas, kefir, sauerkraut, miso, and tempeh. Many probiotic supplements are available in pharmacies and health food stores. Have you tried increasing your fiber, fluid, exercise, and bowel routine and still struggle? In Canada, there are now 2 prescription drugs used to treat chronic constipation that does not respond to other laxative therapy. They are called prokinetics and are only available by prescription from your doctor or nurse practitioner. Restorin, also known as prucalopride, works by improving the strength and frequency of colon contractions, speeding up the passage of stool. It is prescribed only for women, as its effectiveness for men has not yet been studied. It can be used on a long-term basis, but is used more cautiously in elderly patients and patients with heart or kidney disease. Common side effects are headache, nausea, intestinal cramping, and diarrhea. The second medication, known as Constella or lenalcotide, works directly on the lining of the intestinal tract, forcing water into the intestine. It is known to decrease intestinal pain for those suffering with IBS or irritable bowel syndrome. It can be used on a long-term basis and can be helpful for people who are constipated from taking prescription pain medication. Severe diarrhea is a common side effect. Taking this medication with high-fat meals can make diarrhea worse, so this should be avoided. One study has shown that learning a specific technique known as self-applied perineal acupressure, in combination with increased dietary fiber, stool softeners, and increased exercise, can improve bowel function and quality of life for people suffering from chronic constipation. 72% of the study participants reported that the technique helped them to avoid or better manage their constipation. 82% of study participants said they would continue using the technique, and 72% said they would recommend it to family or friends. Because the technique is self-applied and doesn't involve using medication, it carries a lower risk of side effects or complications than common medications used to treat constipation. Speak to a pelvic floor physiotherapist to learn more about this technique. To find a pelvic floor physiotherapist in your community, go to the link on this slide. Learning abdominal massage can also be an effective technique to help with bowel movements. The ILU self-massage technique targets the colon, helping your body to move the stool along. It's called the ILU massage because you will be tracing the shape of the letters I, L, and U when you do it. Some people call it the I love you massage. Lie on your back to do the massage. You might want to bend your knees and support them with a pillow. Hold your hand in a comfortable position, either as a fist, using the edge of your palm, or just using your fingers. Use light to moderate pressure, whatever feels most comfortable for you. Begin by tracing the letter I on the left side of your belly, starting just under your rib cage and massaging straight down. Draw the I 10 to 15 times. Next, you'll draw the letter L. Begin at the right side of your body, just under your rib cage. Massage across your belly from right to left, and then downward, making the letter L. Notice that you are tracing over top of the letter I where you massaged previously. Do this 10 to 15 times. Finally, you'll draw the letter U. Start to the right of your belly button, placing your hand just above your hip bone. This time, you'll massage up your belly towards your rib cage, then across your belly from right to left, then downward on the left side towards your hip bone, tracing the letter U. Repeat this letter 10 to 15 times. You can do this massage at any time of day. Remember that you are not just stroking your skin, you are massaging the structures underneath. You need to feel this massage. If you feel no pressure, you are probably not massaging hard enough. And if you feel pain, you are massaging too hard and need to release some pressure. This massage should feel good. If your pelvic muscles are too tight to allow a bowel movement, called dysenergic defecation, pelvic muscle physiotherapy will be recommended for you, as discussed in Module 4. Botox is occasionally used to weaken the pelvic floor muscles. It is injected in small amounts and lasts for 3 to 4 months, making bowel movements easier. Your pelvic floor physiotherapist will assess whether Botox therapy is appropriate for you and will refer you to a clinic specialist if necessary. Botox is not a commonly used treatment for constipation and is not widely available. Another less common therapy is a sacral nerve stimulator. This module has focused on treatment options for chronic constipation. One final point. Many prescribed and over-the-counter medications slow down our bowel movements and contribute to chronic constipation. You may be more likely to suffer from constipation if you are taking certain medications, such as many pain medications, especially if they contain codeine, anticholinergics, including bladder-relaxing medications, antihypertensives, which lower your blood pressure, muscle relaxants, iron or calcium supplements, calcium channel blockers commonly used in the treatment of chest pain, unusual heart rhythms, or high blood pressure. Many mood-altering drugs such as antidepressants, anti-anxiety, and antipsychotic medications, antacids, and allergy medications which contain antihistamines. If you are using any of these medications, take proactive steps to prevent or treat constipation. Never stop taking medication on your own. Rather, speak with the prescribing physician or nurse practitioner to see if there are alternatives that may be less constipating for you. Chronic constipation is a common problem, and it can be challenging to find the solution that works best for you. Eating enough dietary fiber, sitting in the best position on the toilet, drinking enough water, daily activity like walking, not postponing the urge to have a bowel movement, and certain laxatives are all helpful and appropriate strategies for relieving constipation for most people. For some, pelvic floor physiotherapy, prescribed laxatives, or the use of Botox are necessary. If you remain chronically constipated, speak with your doctor, who should look for underlying diseases or other causes.